now where the north of the country has been overwhelmed by the virus. An emergency field hospital has opened in Cremona, in the heart of the Lombardy region, after being transported there by the Samaritan's Purse International Relief. The hospital has 68 beds, a special respiratory care unit and 20 tonnes of other medical equipment. Kelly Seitz, a disaster response nurse with the Samaritan's Purse International Relief, is joining us now. Hello to you. Thank you for joining us. Huge round of applause, virtual hug for you and all of your colleagues who are working so hard. How hard has it been to set this up?
Thank you. Good morning. Well, we are used to setting this field hospital up, so it just depends on the situation. But this current time, we set it up in about 56 hours from beginning to end, and we were totally operational right after that.
Okay, that sounds almost impossible. Talk to us about how challenging it is being in that area at the moment.
It's definitely challenging. We're in the epicenter of the most cases in this region. The most fatalities in the whole world are happening here in Italy, in northern Italy. So the hospital that we're partnering with and supporting has 600-bed hospital normally. 500 are now being used for COVID patients, coronavirus patients. Out of that 500, 100 of that patient number is medical staff that have now fallen from the disease. So we're here to support them, take a little bit of pressure off of them, and help with their patient flow. We have 8 ventilated patients currently. We currently have a census of about 50, and by the end of today, we'll be at full capacity.
Yeah, I mean, you've moved out to the car park because the main hospital is full. That cannot be an ideal place to treat patients who are critically ill.
Actually, it's working out great. We have our field hospital is perfect. That's what it was designed for. And we have tents with patient wards and isolation and ventilators. So it's actually fine. We have everything that we need to support those patients. We have our own oxygen. We have our own electricity. So we're actually set up very well.
The level of sickness, so you're talking about, 20% of the patients being medical staff. There's an awful lot of pressure on everyone there. How long are your shifts at the moment? How hard are you working? Are you getting any time off?
We're trying to keep our medical staff in 12-hour shifts because when they're tired and not rested, they're actually more vulnerable. So, and they're not on their game. So we're trying our best right now to keep it that way. We're working about 15 hours a day, though, 24 hours a day, 7 days a week operation.
My goodness. This is, I think, your 19th deployment, if I'm right in saying, to a disaster area, including a stint in Liberia where you were battling Ebola. How does what's happening there, where you are now, compare to that?
Yes, I've had 4 Ebola deployments. The first 2 were in West Africa during 2014 outbreak. And I feel very similar to how I felt then, when there was no vaccine, no treatment plan, nothing but supportive care. So it's similar here. It's a new virus. It's new to everyone. We're working on trying to figure out what works, trying to just offer supportive care. But it is a feeling of helplessness, like we're out of control with all the things that we can do. We just hope the best way is for people to follow the guidelines, to stay home and wash their hands and do all of those things so that the hospital can kind of catch up, take care of the patients that we have and not get inundated with more patients.
Okay, a final thought. You're American, obviously. What's your advice to your fellow Americans? We heard in a report a little bit earlier on that, the epicenter could be New York very soon and that COVID-19 is coming towards them like a freight train. What should they do?
Yes, it's very hard for us. Those of us who are American, we have a lot of other nationalities on our team, but our heart is heavy for what's going on back at home. But my advice is to follow the recommendations because it really does matter. It's not a hype. It's not out of panic. It's a public health strategy to keep people isolated. We have to protect the hospital staff so they can maintain capacity and not be overwhelmed, which is what's happening in Italy right now. They just have so many patients on ventilators and sick that they can't manage that. So that's why we need everyone to adhere to the restrictions, and then we can like work on digging out of the hole.
Okay. Please take care of yourself. Amazing work. Thank you and your colleagues for what you're doing. We appreciate it. Thank you.
Thank you.
Would you do that? Would you have the nerve to do that? How amazing is that woman? We know many of you watching us from airports around